Good morning, everyone. Thank you so much for joining us today. My name is Susie Chant. I'm the Parliamentary Secretary for Senior Services and Long-Term Care. I would like to acknowledge today that I'm speaking from the traditional territories of the Lekwungen peoples and the Songhees and Esquimalt nations. It's great to be here for this exciting announcement about another step our government is doing to better support people working in long-term care homes and strengthen the quality of care for seniors, elders, and people with complex care needs across British Columbia. To get things started, I will invite the Minister of Health, the Honourable Josie Osborne.
Thanks. Thanks so much, Susie. Hello, everybody. It's a pleasure to be here. I'm Josie Osborne, BC's Minister of Health. And like Susie did, I want to take a moment to acknowledge the territory that we are here on, the Lekwungen-speaking peoples, that of the Lekwungen-speaking peoples, the Songhees and Esquimalt nations. It really is a privilege to be here and share the significant steps that we are taking to better support seniors in publicly funded care homes. And just as importantly, the dedicated workers who show up for them each and every day. Every senior in British Columbia deserves dependable, compassionate care, care that's delivered by workers who are respected, supported, and provided fair wages, strong benefits, and meaningful protections. Because when we support these workers, we are directly supporting the seniors that they care for. These priorities are inseparable. Today, I am pleased to share that the Ministry of Health, the Health Employers Association of BC, and the Facilities Bargaining Association have reached an important agreement. This agreement will bring eligible, publicly funded, unionized care home operators into HEABC membership, ensuring their workers are covered by an HEABC negotiated collective agreement. This is a major step forward. It strengthens consistent labor standards across the long-term care and assisted living sector, supports a stable and sustainable workforce, and it helps reduce turnover. Most importantly, it means the workers who care for seniors each and every day can continue to offer the familiar, reliable care that seniors and their families depend on. Right now, more than 5,000 long-term care and assisted living workers, many of whom are women and racialized workers, still don't have access to pensions and benefits comparable to those who are doing the same essential work in our hospitals, even though they perform the same demanding and often emotionally challenging work. This agreement helps to close that unfair gap. With this agreement, more than 100 eligible facilities will transition into HEABC membership. And by doing this, we're supporting fairness for workers. We're ensuring that they're receiving equitable wages and benefits and protections while strengthening the care that seniors receive. So let me provide some of the important details. This agreement is subject to ratification votes, which are expected to conclude by December 20th. The transition will take place in 2 phases. Approximately half of eligible operators will transition by September 30th, 2027, and the remaining half by September 30th, 2028. During this transition, wage leveling will continue for HEABC eligible sites until at least March 31st, 2027. This will provide stability for workers and help ensure consistent and high quality care across the province. We know that the best care for seniors comes from workers who feel respected, supported, and treated fairly, no matter where they work or who employs them. And we know how much it matters to seniors and their families when the person providing care is a familiar face. When staffing is stable and turnover is low and meaningful relationships can grow over time. Consistent care strengthens trust. It supports better outcomes and it gives families peace of mind. So this agreement will help ensure the continuity of care that seniors deserve and the workforce stability that care homes across British Columbia need. Thank you so much. I'm so grateful to see so many of our partners in the audience today joining us for this really important announcement. I just want to say thank you so much to Labour Minister Jennifer Whiteside, who's joining us today. It's really great to see you, Barb Nitterpaul from the HEU president. We've got Betty Valenzuela is in the audience. Fantastic. I know Lynn is going to be speaking in just a moment, and so many other of our partners and supporters. We can't do this work without you, and we know just how much the seniors and elders in our province are relying on us to ensure that this kind of consistent provincial framework is something that we return to so that we deliver the care that our seniors deserve. Thank you so much. Pass it back over to you, Susie.
Thank you so much. So thank you, Minister Osborne. And I'd now like to invite Lynn Bickett, Secretary Business Manager of the Hospital Employees Union, to say a few words.
Thank you. And thank you, Minister Osborne, for your remarks and for your continued commitment to strengthening seniors' care in British Columbia. Today's announcement marks a major step forward in repairing and rebuilding a seniors' care system that has been deeply fractured by 2 decades of privatization. It's a step forward for fairness for workers, stability for seniors, and a more accountable public system for all British Columbians. The truth is, our seniors' care system in BC is deeply fractured, and it's not working for the staff who deliver the care nor the seniors receiving it. It's a system where publicly funded care homes offer widely different wages and working conditions depending on who owns or operates the site. A care aide in one facility might have a pension and 18 sick days. A care aide doing the exact same work just a few blocks away might have no pension and only 7 sick days. This did not happen by accident. It's the result of deliberate policy decisions made by the former BC Liberal government, policies that allowed operators to opt out of standard public agreements and encouraged widespread contracting out. Workers were fired en masse, only to be rehired by private contractors at lower wages and with fewer benefits. And when those workers got their feet under them, employers flipped the contracts, triggering more layoffs and further eroding stability. This approach created a fragmented, low-wage sector with high turnover and a serious recruitment and retention crisis, and it hit women and racialized workers the hardest. It disrupted care relationships. It weakened standards and undermined quality care for seniors. And that is what today's announcement is about. It's about ending the policies that drove down wages and pushed workers to the margins. It's about making sure that workers and seniors are treated equally, no matter where they work or where they live. With this agreement, more than 5,000 long-term care and assisted living workers will return to the protections and benefits of the facilities collective agreement, the same standards already in place in our hospitals and in public care homes. This is a big win, a win for workers who've held the system together, a win for seniors who deserve continuity and quality in their care, and a win for public health care in BC. And while this is a significant achievement, we know the work isn't finished. There are still care homes and workers outside this agreement. We'll keep fighting until every healthcare worker has the wages, benefits, and protections they deserve, and every senior receives the consistent, high-quality care they need. And to every HEU member who's kept the pressure on, stayed united, and never gave up, thank you. And back to you, Susie.
Thank you so much. Thank you, Lynn. I'd now like to invite Adele Buckhead to the podium, please. Adele is a care aide at the Windermere Care Home in Vancouver and has spent over 20 years caring for the residents in that long-term care home. Thank you.
Good morning. Thank you, Lynn, and thank you, Minister Osborne. I've been a care aide for the past 28 years, and I still love my job. Caring for seniors is a meaningful work. From 1997 to 2004, my facility was part of a public sector agreement. That meant I had a decent wages, benefits, and a pension. It gave my family and me some stability. But in 2004, everything changed. Everyone was fired and the site was contracted out. We all had to reapply for the same jobs, but under a private contractor. Only a few of us were hired back. My sister, who also worked as a care aide at the same facility, did not get rehired. I got to work the same care home but lower wages, fewer benefits, and no pension. It was hard, not just for us, but for the seniors. Suddenly, there were new faces and lots of turnover. My pay dropped from $23 an hour to $15 an hour. That was a big shock, especially with my young family. Then, in 2007, it happened again. The contract flipped to another company, and once more, I had to reapply. Again, lower wages, poor benefits, and no pension. We trained new staff, but not many stayed. The pay wasn't enough, and the workload was heavy. In 2023, our site was sold, and we became members of the facilities agreement. This was a good news, but I worked for 20 years without accumulating pension. Now I'm rebuilding my pension, and means that my coworkers will have a chance to retire. I also have a better sick leave. My wage matches other care aides doing same work, and staff are staying. That makes a big difference to our residents and see familiar faces and feel safer. The care is more consistent, and that matters. I've lived through the cuts. I've seen the impact it has on the workers and the seniors when a cared work is privatized. That's why today's announcement is so important. Bringing care workers back under the public agreement doesn't just improve our working lives. It improves the care for seniors receive. This isn't just about the pay. It's about dignity for workers, for seniors, and for their families who trust us. Thank you to the government for recognizing our work matters and making sure we're supported to do it well. And thank you every worker who stood with us, who kept pushing. I'm proud of what we achieved together. Thank you.
Thank you so much, Edel. It's so wonderful to have that first person story of what it would be like. So difficult for any of us to imagine losing a third of your wages overnight because of a decision that government of the time took. We are proud of the work that we're doing together with the HEU, with the workers, and mostly you heard it straight from Edel herself. This is about supporting seniors and elders. It is about delivering better care. It is about supporting the workers who provide that care in a consistent way across workplaces here in British Columbia. With that, really happy to take your questions.
A reminder to reporters on the line, if you'd like to ask a question, please take yourself off of speakerphone or Bluetooth, then press *1 to enter the queue. You'll be limited to one question and one follow-up. We'll start with questions right here in the press theater. And our first question is from Keith Baldry, Global News.
Hi, Minister. This morning, a coalition of people who describe themselves as drug users, students, and healthcare workers had a demonstration releasing pledges to defy involuntary care policies and orders that are coming from your government. What's your reaction to that, and what are the consequences healthcare workers face if they defy new policies and guidelines when it comes to involuntary care?
Well, first and foremost, I think it's really important to point out that we are building a comprehensive system of voluntary care for people with severe mental illnesses, for people with opioid use and other substance use disorders. And that care is absolutely essential. So everything from early intervention and prevention to help youth and others from stopping problems getting worse, to building out more treatment beds, more non-bed based treatment options for people, recovery for people, really supporting them on the road to recovery as they move through the healing that they need to do. Involuntary care is just one aspect of our mental health care system. And of course, the Mental Health Act, with its strict guidelines and criteria for admission, helps to provide care for those people who are simply not in a position to be able to make decisions themselves. I have met with and heard from many family members who care deeply about their loved ones who maybe are experiencing psychosis or schizophrenia or some other form of very severe mental illness, and they want them to get the help that they do. That's why the Mental Health Act, together with other pieces of legislation, affords the protection for healthcare workers here in the province in administering that treatment. We will continue to build out that voluntary system of care while at the same time focusing on involuntary care when and where it's needed.
Secondly, your government announced some months ago that illicit prescribed drugs would have to be administered in the presence of a trained healthcare professional. The Globe today is reporting that's going to start mandatory on December 30th. Can you confirm that and walk us through how this is going to actually unfold in real time? And secondly, any update on how that woman was able to access that NICU ward and have physical contact with babies?
Following in the fine Richard Zussman tradition, you have packed two questions in one.
I could have done
I
three.
appreciate that. So first of all, we will be announcing this week an update around prescribed alternatives. For now, I'll just say prescribed alternatives remain one of many tools and strategies that we use to help separate people from a toxic drug supply, to help keep them alive, to access care. On the very alarming incident that happened at Surrey Memorial Hospital, I know that there's a police investigation underway right now, and of course, Fraser Health is looking at that. It's very important that anything that can be learned from an incident like that is used to adapt policies, and something I know that Fraser Health takes incredibly seriously. We'll let that police investigation, of course, unfold and see where that goes.
Our next question goes to Emily Fagan, CBC.
Thank you, Minister. I was just wondering, with these new changes that you're announcing today, will it bring any additional costs for the provincial government? And if so, what will that look like?
Yeah, thanks for the question. So yes, there will be some additional costs that come from this. And again, it's really important to recognize that this is about providing a fair and predictable set of working conditions, labor standards, of course, fair wages for workers across the publicly funded long-term care sector. So estimate in the order of around $85 million to do this work. And of course, as has already been noted, this is the beginning of more work that has to be done to continue to come back to that fair, consistent framework that we had at one time in this province, where working conditions are such that workers are supported with dignity and respect in what they do, that they stay, those long-term relationships, reducing the kind of staff turnover and recruitment problems that we saw through the 2000s, right up into COVID. We saw where that got us during COVID. It is vitally important to this government that we continue to do everything we can as we build up that dependable, predictable system of care that seniors must be able to depend on.
Thank you. And following Keith's question as well. So drug users, students, healthcare workers are, among those who are calling the NDP's involuntary care campaign reckless and say that type of care, doesn't prevent death. What is your response to this type of criticism?
Well, again, involuntary care is a form of care provided for people under a very specific set of circumstances. And I know that part of the public conversation right now has been around those people experiencing severe mental illnesses concurrent with substance use disorders. This is the work that Dr. Vigo has been advising our government and the Ministry of Health on, and why we have expanded some forms of involuntary care. But involuntary care already exists here in the province. We have 77 designated mental health facilities across BC that provide care for people, sometimes for a short time, sometimes for longer times, experiencing severe mental illnesses. And I think that I hope that people can agree that this is in the best interests of people at some points in their lives, depending on what is taking place. That's why we have clinical professionals who make these judgments and decisions, who provide this care. And again, I have heard directly from people who have lived experience with involuntary care, from their family members, about the fact that in some cases it has literally saved their lives. It's incredibly important that we, again, follow the guardrails that are there in the Mental Health Act. Is partly why our government will be moving forward with a review of the Mental Health Act to make sure that the respect, the dignity that all people deserve is always there. It is person-centered care when very sensitive decisions are made about looking at an individual's rights versus their ability to be able to make the best decisions for themselves. Thank
Next question comes from Rob Buffum, CTV.
Hi, Minister. Thanks for taking my question. My question is on behalf of a colleague who wants to know, why is BC hesitating to make nasal naloxone free when it's already free and available to most Canadians?
Thanks for the question. There's no hesitation about the use of nasal naloxone and the importance of that. It's together with intramuscular or injectable naloxone, a really important tool. We have undertaken a pilot study on nasal naloxone. I'll have more to say about that soon. We want to make sure that it gets into the hands of the people who need it most, and we know that people are eagerly anticipating that.
I guess by way of follow-up, she wasn't suggesting that there is hesitancy in relation to the use of it, but BC, unlike places like Ontario, Quebec, the Yukon, Northwest Territories, where they make it available to the entire public for free, BC is not doing that. The pilot project you referenced was supposed to be finished at the end of the summer. My colleague with CBC had an article I just read. Yeah, so I guess what's the holdup? We're now in November. The review was supposed to be done months ago, and many people agree that nasal naloxone is much easier to use than the injectable kind. So why the holdup?
Well, yeah, I agree. Nasal naloxone is much easier for many people to use, and it's important that it gets out into those people's hands who need it. Naloxone, whether it's nasal or injectable forms, is a really important harm reduction tool. Again, that saves people's lives, and I'll have more to say about it soon. Thank you.
Okay. Our next question is from Wolfgang Deppner, Canadian Press.
Yeah, hi. Thank you for taking my question. Minister, you talked about the importance of continuity of care. And if I heard you correctly, you pegged the cost of this transition at $85 million. How can you reconcile this appeal to continuity of care and the additional expenses when your government is not renewing COVID-related supports? You also mentioned COVID in your rationale for senior care, long-term care. How do you reconcile these two things? Do you spend more money on this side, citing some of the very same reasons that you can also justify to spend money on that side? Thank you.
Thanks for the question. It's an important one. And again, this is about returning to a consistent provincial framework that supports workers in a way that is fair across work sites, across job sites, and different long-term care operations. What it is about, what it isn't about is maintaining a patchwork of approaches. The COVID funding that we use to fund overtime, to help support overtime and agency costs, were about dealing with the pandemic at the time and the extraordinary pressure that was placed on the sector. It has been used differently by different operators, and we want to move back into that system where we had predictable, consistent set of workplace conditions, fair wages for people, access to benefits and pensions, supporting the workers so that they can provide the care to seniors. Ultimately, this is about that consistency of care for seniors. So as we work towards a stable and predictable funding model, that's why it's important to make a step like we did today and be able to provide that for those publicly funded beds across the province.
By way of follow-up, what, if any, news might you have for operators who are now sort of in a position where they have to choose between funding different types of beds? What if any financial support might those operators receive in the future? Thank you.
Sorry, could you just repeat the last
Oh yeah,
part?
sorry. What if any additional financial support does government have sort of in mind to Obviously, you're not renewing the COVID supports, but what if any additional supports might be coming down once you've sort of figured out procedures and standards?
Yeah,
Thank you.
thank you. So again, your long-term objective here really is about creating a fair and consistent funding framework across the sector. And that is really building towards the three fundamental goals we have around quality of care and quality of service and quality of life for the people in long-term care homes and who are receiving that care. So we're going to continue moving forward with the steps that we've already taken around increasing the number of hours of care per resident per day, around developing a quality framework, around developing the funding model, as I said, improving the long-term care financial reporting tools. These are all pieces that are being put into place as we move towards that consistent, long-term, predictable framework that all publicly funded beds will be operating under. And today's announcement is such an important part of that because, again, it's about treating workers fairly, the people who deliver care in these homes, and ensuring that seniors and elders are getting the care that they deserve at the time of their life when they need it most. It's reflected to me how working conditions really are caring conditions, and that's why it's so vitally important that we make today's step.
Next question is from Andrew McLeod, the Tyee.
Yeah, just trying to make sure I understand a couple things. Like you said, this continues wage leveling for another year or 2 years, depending on the facility. That is the COVID funding, right? That we like that was introduced during COVID to keep the workforce stable. No.
Wage leveling was one of the tools that was introduced. That's right. It is separate from the temporary funding that was used to support agency and overtime funding.
Okay. And one of the criticisms at the time was that you were essentially paying the facilities to do what they already should have been doing. How does this move beyond that?
Because this is about ensuring that there is a consistent framework. We're returning to that consistent framework across publicly funded work sites. So for those operators that are eligible coming in under HEABC and having one set of provincial collective agreements that really drives the standards around working conditions, around fair pay, around access to benefits and pension, things that are important to workers. And I just want to go back to what we heard directly from Edel and how much of a difference that makes in knowing that you can stay employed, reasonably and happily employed in one facility and be able to deliver care to the residents there through the formation of long-term relationships with the residents and with their families, and just how vital that is. In a publicly funded system, being able to provide that consistency of dignity and respect to workers that translates directly into the care and the dignity and respect for the residents receiving that care.
Okay. And Lynn had mentioned some people still won't be included. So who's still going to be left out at this point?
So those operators who have fewer than 50% of their beds publicly funded are not covered in this agreement. This is going to impact about 5,000 workers at over 100 facilities. There is still more work to do, and we're not going to stop as we move forward with that.
Last questions in the room before we go to the phones. Here is Jeremy Hainsworth from BC Today.
Hi, Minister. Thank you for taking my question. You just talked about homes that are not particularly covered by this situation. There are some homes that are both public and private beds. If you've got a situation where the workers' wages are going up and that's impacting how a facility operates, is there the possibility here that those people who are paying privately are going to see their rates go up and maybe forced out? How's that conversation been factored into all of this?
So this agreement does not impact those privately run facilities who don't have contracts with health authorities to operate beds, for example. But this is about, again, creating conditions for workers that are fair, that are consistent, and private operators will need to make the best decisions they can about their workforce. Private operators are part of our long-term care landscape. They're valuable partners in providing that care. Of course, they are subject to the same standards that we expect and demand of all long-term care facilities. And we'll continue to hear from them and to work with them. But today's announcement focuses specifically on publicly funded beds.
Follow-up, Jeremy?
Yes, please. To go back to the involuntary care situation, please correct me if I'm wrong, but a lot of my research indicates the people who are undergoing involuntary care are people who've been taken into custody. And I'm not seeing much in the way of, Mr. and Mrs. Smith from Chilliwack saying, hey, our kid's got a real problem here. We want to get them into involuntary care. Am I wrong here, or is it just people who have been arrested and are, have been convicted or are awaiting trial?
There are people who have had no interaction with the criminal justice system whatsoever, who are experiencing severe mental illnesses. We see that in our society. We know that there are youth and adults alike experiencing that, and it's critically important that they get the care that they need. So again, involuntary care is part of a mental health care system throughout the province. There are thousands of people who access this kind of care every year, and it may have nothing to do with the criminal justice system. Now, with respect to that, though, we do know that there are people who are incarcerated, who are experiencing severe mental illnesses, who do have substance use disorders. That is in part where we stood up the Surrey Pretrial Center with 10 beds there, so that inmates or people awaiting they're being held on remand have access to the care that they need. That was something that Dr. Vigo provided advice to our government around, a gap in our system, and it is one that we have taken steps to close.
Now to the phones. We have a question from Alec Lazenby, Vancouver Sun.
Hey, Minister, correct me if I'm wrong, but the requirement for safer supply medications to be taken under supervision, that was something that was announced back in February, a measure that you were going to be taking. It's now December. Why has it, I guess, taken so long to get that into place? And were there delays? Was it supposed to be implemented earlier, but it just took longer to put in place? Like, what's the situation here? Why was it announced in February, but it's now being implemented here in December?
Well, you'll recall that when we made this announcement in February, that anybody who was newly being prescribed pharmaceutical alternatives, was immediately to go into witness consumption. That took place. But for those people who were not, to be sensitive and and methodical in the way that they're transitioned takes some time, and that transition had to be developed with guidance from clinical experts. That's what we'll have more to say about later this week to explain and show exactly how that's going to roll out. But again, this is about making the best healthcare decisions for people and making sure that as they transition into witnessed consumption, that it's done in a way that is effective and that is safe. And again, their safety is a top priority.
Alec, do you have a follow-up?
I was just wondering, what do you say to, I guess, advocates who are concerned that some of the changes to, say, witness safe supply, decriminalization, the expansion of involuntary care, that's not going to help solve the problem we've seen, and are linking it to, say, an increase in overdoses, both here on Vancouver Island and in Vancouver. We saw the fire department responding to numerous overdoses over the past few days. Just wondering what your thoughts are on the comments from those advocates and the fact that, overdoses are going back up.
The toxic drug crisis that we're facing is, I think, one of the most difficult things our society has ever faced. And every single day, I certainly reflect on the lives that have been lost and how incredibly difficult this is for families and for communities. It is an evolving crisis. The illicit drug supply itself is changing all the time. And I think that, we see that in drug checking, for example, in the analysis that's done on illicit drug supply and the increasing number of poisons and contaminants that are put into it. That's why it's so vitally important to do everything we can to separate people from that illicit supply. And that's, prescribed alternatives are one way of doing that to help people move into opioid agonist treatment, for example, move away from that illicit drug supply and move into treatment. Decriminalization has been one of those tools as well to help separate people from that supply. And again, this is about moving people when they're ready into treatment. We have to continue to adapt and change as this crisis changes, and we have to continue to build out this voluntary system of care that intervenes early in a person's life, that helps to prevent these problems from getting worse. And that is done through everything like Foundry Centers for Youth, increasing the amount of community counseling that is available for people, the things that people need to see. Our government's going to continue to do this. We're going to continue to take these actions. I understand that there are varying perspectives around how much leniency, for example, should be applied in these tools. But it's also vitally important that we make sure that prescribed alternatives, for example, do not get into the hands of people that they're not intended for. So that's why moving to a witnessed model, a witness consumption model, has been an important part of our efforts. We are always looking, learning, monitoring what's going on. We will be adapting as circumstances change. But one thing we will not change is our commitment to building out that continuum of treatment and recovery and in this mental health care system and toxic drug crisis that we're all experiencing.
Our final question is from William Burr, Radio Canada.
Thank you, Minister, for taking my question. On involuntary care, one of the groups putting forth this petition wants more voluntary care. And I know you've mentioned that a few times today, but for example, they mentioned that someone waited for 3 days outside St. Paul's Hospital recently because he wanted care, a detox facility. How do you respond to that saying, why not invest more in voluntary care for people who actually want to get help?
Yeah, thank you. Thanks for the question. That is exactly what we have been focused on, which is expanding the system of voluntary care, adding more treatment beds, adding more access for people who live in remote communities, for example, to receive that help. The Road to Recovery program that was born out of St. Paul's Hospital has been one of the most innovative and effective programs that we have seen, because it is a continuum of care where a person can call a telephone line, visit a healthcare provider, and through this Access Central, they receive an assessment, and within 24 hours can be entered into a voluntary treatment system at the right stage for them, wherever they are on that road themselves. This is a program that we are committed to expanding across the province. We are seeing how much of a difference it is making in people's lives. And by closing those gaps and preventing people from falling through the cracks between different stages of their recovery journey, I think it's also really important to remember that substance use disorders are chronic relapsing diseases, and that it is important to be there for recovery afterwards and to help people who may slide backwards and need to enter in again. This is a disease that people experience that we need to treat with dignity, with respect, with the best and with the best clinical care possible. That is the commitment of our government, and we're going to continue this work.
William, do you have a follow-up?
No, thank you very much. Thank you.
Okay.
Thanks so much, everybody.
Thank you for joining us. That concludes today's event.